one of the, Roger and I go back a long way. We served on the Industrial Commission together. I was the Attorney General when Roger was the Ag Secretary in North Dakota. And so we've seen a lot of ups and downs in rural America. Part of Roger's resume that a lot of you probably don't know is he got his start in government by helping distressed family farmers who were struggling with low commodity prices, bad loans, and no hope. And so Roger has sat across the table from families who find themselves not knowing where to turn and where to go. He has helped them work through their economic challenges, but he also has seen how critically important access to health care is and access to affordable insurance is as part of that, our rural communities and our family farmers' daily existence. And so I wanted people to know, Roger, that when you talk about this, it's not as now the all-important head of the Farmers Union of the United States and of America, but it's from the perspective of someone who has sat across the table from family farmers who literally, in many cases, way too many, we were lost because from death as a result of suicide. And so I thought it was important that the people here understand your history and your background.
Thank you so much. Roger Johnson, welcome.
Thank you, Senator Heitkamp. Thank you, Chairman Stabenow. And thanks for holding this hearing and for the opportunity to testify before you. National Farmers Union represents 200,000 family farmers, ranchers, and rural Americans across the country. During my time as North Dakota's Ag Commissioner from 1997 to 2009, the cost of health care was the most frequent concern I heard when talking with farmers and ranchers. Preceding that time, the time when I was a credit counselor that Senator Heitkamp mentioned, the single most common reason for farmers going through bankruptcy or facing foreclosure was health care bills that could not get paid. This is no small thing. It's a big deal. Many farmers have sought full-time off-farm jobs for themselves or their spouses primarily for health insurance benefits. As time went on, single-family policies have become increasingly unaffordable, and many farmers were forced to go without health insurance. Our member-driven policy affirms, quote, the right of all Americans to have access to affordable, quality health care, end quote. We cannot support legislation that will cost 23 million people their health care coverage. The House bill fails to address many of the problems that farmers and ranchers face in accessing coverage, including desperately needed stabilization of the health insurance marketplace. The act hurts older farmers by permitting insurance companies to charge much more to their older customers. The increased tax credits many farmers would receive will not be enough to offset the premium increases of thousands of dollars they will be charged. Basing tax credits on age instead of income would be extremely harmful to small and beginner farmers as well, who often face high startup costs and lower incomes. Those that don't receive additional income or health benefits from off-farm jobs would find it extremely difficult to purchase health insurance. Jimmy Dula, a young Farmers Union member from Colorado, provides one example of how important the Affordable Care Act's income-based tax credits are to young farmers. Jimmy began farming in 2012. Despite working a variety of off-farm jobs, he was unable to afford health insurance for 3 years. In 2015, he qualified for the advanced premium tax credit, which allowed him to find affordable coverage through Colorado's marketplace. If the House bill were to pass and become law, young farmers like Jimmy would again face all of the physical demands and dangers of farming without any health care coverage. Individuals with pre-existing conditions would again face an impossible situation. Farmers are much more injury-prone and significantly older than average workers. Many will be forced into high-risk pools, leaving them to contend with increased premiums, higher deductibles, and longer waiting periods for coverage. Financially, today, times are very difficult for farmers. Average net farm income is half of what it was 4 years ago, is expected to drop below the cost of production this year, meaning net farm income will be negative. for most farmers. One might expect that farm income and expenses would then dominate farmers' concerns, especially as work on the 2018 Farm Bill is underway. However, just recently in 14 rural issues discussion meetings held in Minnesota by Minnesota Farmers Union earlier this spring, the cost of health insurance dominated the list of people's worries. Farmers view health care access and insurance coverage as a critical part of the farm safety net and are afraid of going back to the bad old days when they simply couldn't get coverage. NFU is deeply disappointed and very worried by the lack of transparency in the process that's unfolding in the Senate today. This issue is far too important to be dealt with in secrecy. The needs of farmers, ranchers, and rural Americans must be seriously considered as conversations on health care reform occur. While there's certainly opportunity for improvement in current policy, the American Health Care Act will only hurt family farmers and rural communities across the country. Thank you for acknowledging the unique needs of family farmers and ranchers and for holding this hearing today.